Have you ever looked in the mirror or compared yourself to what you see online and thought, is what I have really enough? Well, you're not alone. This is the #1 question I get on my social media. How can I get bigger? How can I get longer? Or how can I get more girth? Today, I'm going to face those questions head on and give you the evidence behind penile lengthening treatments. I'm Dr. Masha, urologist and pelvic surgeon. But first, please like the video. The more people like it, the more YouTube will distribute it to people who don't have access to doctors or hospitals. Also, please share the video with your friends and family. Many lives can be saved with your help, so share it. A major survey of 50,000 heterosexual men revealed something surprising. 55% of them were unhappy with how their penis looked. Yet when researchers asked their partners, 85% of women said they were satisfied with their partner's genitals. The truth is, it matters most how you feel about your own appearance. But there's a big complication here. Pornography has twisted the definition of normal, setting expectations that don't match reality. I made a video earlier about average penile length, and here's what the data shows. The average length is about 5.2 inches or 13.2 centimeters. Now, it's considered normal for length to fall within 2.5 standard deviations from that, whether a little bigger or a little smaller. Abnormal length, what's actually defined as too short, means anything less than 2.9 inches or 7.5 centimeters. That condition is called micropenis, and it's extremely rare, occurring in less than 1%, actually just 0.14% of the population. Micropenis can be caused by congenital abnormalities, hormonal imbalances, certain surgeries, or even cancer. But today, we're talking about people with completely normal penile length. Here's the reality. Most men who worry about size are actually within the normal range. The deeper issue is that many men still suffer distress, convinced that what they have isn't enough. This form of body dysmorphic disorder even has a name: small penis anxiety. Now, here's where it gets serious. Small penis anxiety doesn't mean someone actually has a small penis. It means they have overwhelming anxiety, obsessing for more than an hour a day over size. For some, it becomes so distressing it interferes with daily life. Some men end up hospitalized, others even develop suicidal thoughts. This is not a joke. It's a genuine men's health crisis that can carry life or death consequences. This is exactly why we need to talk about it openly. Because when you type into Google, "How do I make my penis longer?" you get hit with a flood of websites and ads, many of them untrustworthy, some even dangerous. Men desperate for answers may travel abroad or seek out unlicensed providers who promise miracles. But those choices can lead to devastating, lifelong consequences. Please, don't take that risk. Always look for a reputable urologist or psychologist who understands these issues and can help safely. Now, before I get into treatments, here's an important caveat. The Sexual Medicine Society of North America makes it clear procedures for penile lengthening or girth enhancement are not recommended and are considered experimental, unless the patient truly has a micropenis. Everything I'm about to explain is backed by published urology data, but please remember, before considering anything, always establish care with a qualified urologist. And just so you know, in my own practice, I do not perform penile lengthening. But because this is such an important topic, I did the research for you. So, what are the options? In the medical literature, there are two main categories of treatments for men who struggle with small penis anxiety or distress about size: non-surgical and surgical. Let's start with the non-surgical side. First, psychological counseling. This is powerful. There are validated questionnaires and assessments that help men understand what normal size really is while addressing the anxiety that comes with constant comparison. Here's what's amazing. Men who undergo only psychological counseling without any devices, injections, or surgery often stop wanting additional treatment altogether. The counseling alone is enough to change their perspective and bring peace of mind. That's huge. So, if you're suffering with this anxiety, please consider seeing a psychologist first. There are 3 other non-surgical options often discussed: penile extenders, vacuum erection devices, and penile injectable treatments. Among these, only one, penile extenders, has any real evidence that it can actually increase length. A penile extender is essentially a traction device. It has a hole for the penis, 2 rods along the sides, and a silicone ring at the end to hold the glands. It slowly, mechanically stretches the penis over months, requiring several hours of daily dedication. When used consistently and faithfully, studies show men gained about 2 centimeters in length. But keep in mind, that's just under an inch, and it requires serious patience and commitment. The length was measured both in flaccid state and in what's called flaccid stretch length, which is the closest medical estimate we have for erect length. Still, while gains are possible, results are modest, and complications like numbness, bruising, or even no results at all can happen. By contrast, vacuum erection devices did not increase length at all. And penile injections? Well, that's a road you absolutely don't want to go down. Different substances have been tried over the years, but the results have included devastating complications, even showing up decades later. That's why I strongly urge you, do not inject anything into your penis. Now, let's move into surgical treatments. Over the years, different surgical techniques have been described in medical literature. One of the most common is called a suspensory ligament incision. Here's what that means. The penis is attached to the pubic bone by a ligament, and surgeons release that ligament to give the appearance of extra length. But here's the reality. This procedure is not without complications. Other surgeries have experimented with using skin flaps, grafts, and even rib cartilage to increase length. Sounds dramatic, right? Unfortunately, the outcomes have been disappointing. Studies that reported on these surgeries showed poor satisfaction, inconsistent results, and in many cases, complications that left men worse off than before. Because the research has not been rigorous or consistent, these surgeries simply cannot be recommended as safe or effective. The only context where surgery for penile lengthening should ever be considered is inside a clinical trial. Now, what exactly is a clinical trial? It's a study conducted at a medical institution where an institutional review board, an IRB, monitors everything to make sure it's ethical and safe for human patients. The IRB requires careful data monitoring and reporting of complications. That way, when something goes wrong, it gets documented, published, and shared with the medical community. That's the scientific process. It's how doctors like me can look at a study and say, okay, this procedure was done in 100 patients, 10 had minor complications, but 20 had devastating ones. The risks are too high. Without this system, men would be walking blind into surgeries that might permanently disfigure them or destroy function, and that's not a chance anyone should take. So here's the bottom line. You can't dramatically change the length you were born with. The only treatment shown to work consistently is penile traction therapy, and even then, the gain is modest, about 2 centimeters. Everything else, from injections to surgeries, is either unsafe, experimental, or not recommended. What I urge you to do before anything else is get help for the anxiety. Talk with a psychologist, because the truth is, you are not alone and you are not broken. Many men feel this way, but anxiety can make you believe things that simply aren't true. Don't risk your health, your function, or your future on something that could leave you worse than where you started. Thank you so much for watching. Please make sure you join me next Monday when I'll be diving into penile injections, the substances men have tried, the results, and the complications that followed. Some of these stories will shock you, and they'll serve as an important warning. And as always, remember this: take care of yourself because you are worth it.